So my confession to all of you today is that I am a professional insomniac. This worries me because deficiency of sleep is associated with a lot of health problems. It's tied to weight gain. It's tied to loss of muscle mass versus fat mass in people who are trying to lose weight. It causes, we all are aware, just a slowing of the brain, a difficulty concentrating and thinking the day after a poor night's sleep. Long-term sleep deprivation is associated with depression, even psychosis if it's severe. It leads in the body to insulin insensitivity and diabetes long-term. And most disturbing to me, because of my own personal risk of dementia, it is associated with dementia. And this is because when we sleep, our brains actually shrink just a little bit. And the cerebral spinal fluid, which is carrying the nutrients for the brain and clearing out the detritus of the day, actually circulates differently while we're asleep. And it's cleaning our brains for us. And that work is really important. And so we want to make sure we're getting good sleep. So a lot of patients have been placed on medications to improve sleep because we're really trying to cram what should be a 10-hour experience into a 7-hour window that we allow for it. You know, a normal sleep cycle is to go to bed, drift in and out of a light sleep, get into a deep sleep, wake up a few times, sometimes stay awake for a period of time, go back into a deep sleep. So if you allow yourself 10 hours, you will get 7 to 8 hours of sleep. But it's not normal to go to sleep, stay asleep for 7 hours and wake up. And that is what we Americans who are trying to cram everything into the rest of those hours that is possible, that's what we demand of ourselves. I need to sleep like this. And that's an unnatural thing. So one thing that helps insomnia and helps my insomnia a lot is realizing how unnatural that is. So when I wake up at 2, realize that's just normal. People normally wake up a few times a night, and it's not a big deal, and I need to accept it for what it is, use that time wisely, and I will get back to sleep much more quickly than when I wake up and panic about not sleeping. And that's the problem with insomnia, is that we wake up and worry about our insomnia, and that's not going to help. So the medications that you can use for sleep have pronounced side effects for people, and sometimes these build up over time, but it's a dulling of life experience. You know, they knock you out. Well, they don't just knock you out for 7 hours. The half-life, meaning the time it takes for half of that drug to leave your system, so depending on the drug, is somewhere between 2 and 12 hours. Well, you're not sleeping for 12 hours, and so it takes a long time for those symptoms to go away. Some of the drugs have pronounced side effects like strange sleep behaviors, like eating in your sleep, driving in your sleep, talking in your sleep. Those are concerning too, but more rare. But most concerning, again for me, is long-term, and it's cumulative exposure to sleep agents, any of them, from over-the-counter Unisom to Benadryl to high-potency drugs that we might prescribe, trazodone, Ambien, Sonata. All of them have been shown to increase the risk of dementia. So that's not something I'm interested in increasing in my patients. So I've been trying to figure out, well, what are some lifestyle and then more natural approaches we can use to help people accomplish a better sleep. One of the best things is to minimize your exposure to bright light in the evenings. Once the sun goes down, whenever that is, you should turn down the lights in your home. Turning on the bright lights to mimic daylight at night is going to prevent you getting tired and prevent you from going to sleep. Keeping your screen exposure to a minimum in the evenings. The bright blue lights that come off of our screens suppress melatonin secretion and prevent the onset of sleepfulness. The other thing that a lot of us do is push through our sleepy window. There's a natural biorhythm to the sleep cycle, and when that biorhythm hits, if you write it down, you're going to get your best night's sleep. If you push through it, it's then very, very hard to catch that sleep next time it comes through, and you might find that, wow, if I just ride through the time 9:30, say that I'm naturally sleepy, push through that, well then I have a hard time going to sleep until 2. So I just get a lot done. Well, that's not really healthy. That's not the way your body wants you to do it. It wants you to ride that rhythm down and just go to sleep when it's time to go to sleep. So turning off the screens, minimizing your bright light exposure, and then in the morning when you do wake up, getting bright light exposure to tell your brain, now is daytime, now it's time to get up and go. Hit that circadian rhythm and tell it, I want to be awake now and I want to go to sleep then. Using light to help you do that is extremely effective. Exercise, moderate daily exercise, and it doesn't seem to matter when you do it, improves sleep. Now you might not notice this for 4 to even 24 weeks, but it does improve sleep. So you just have to keep doing it and trust that it's going to hit. One thing I find very fascinating is that when your brain is cold, you are sleepier. I'm sure you've all noticed this, like in the airport waiting for a plane, you feel drifty. If the colder it is, the sleepier you get. So in the wintertime, open your windows, crack them just a little bit, let your house get cooler. In the summer, in the south, that's not a good option. You're going to need to use your air conditioner, turn on your fans. But you can also get these pillows, these gel top pillows that you can keep in your refrigerator. And if you wake up in the night, you can put one of those cold gel tops on top of your pillow. And it has been reported back to me by a few patients that that really does help them return to a better sleep. Avoiding alcohol, avoiding caffeine. Even in the morning, caffeine's stimulatory effect in some people can be quite prolonged. Some of us, it isn't. And if you're that person and you can drink a cup of coffee and go right to sleep, it's probably not a big issue. That's not me. So I have to have my 1 cup of coffee in the morning and no more. But some people can't even do that. So play around with that. Alcohol, we all notice that when we drink a little bit, we feel a little tired and we maybe want to use that effect to help us get to sleep at night. But when it wears off a few hours later, it's going to have a reverse effect and it's actually stimulating, and you're going to wake up and you're going to feel kind of jangly and unpleasant. So, and that will certainly disrupt your sleep the rest of the night. So don't use alcohol in that way. Very, very low doses of melatonin, like 0.5 milligrams to 1.5 milligrams are the best doses. You'll see melatonins out there that are 10, 20 milligrams. And we American, if some's good, more is better. So, do not fall into that with melatonin. The more you take, the more side effects you'll have the next day, but it actually is a very subtle signaler, and too much of that can be a problem. And melatonin at those low doses is very safe, so I'm comfortable recommending it broadly. There's a particular approach to mindfulness called mindfulness-based stress reduction. There's a very formalized 8-week course that you can take, and that has great data that improves sleep. Meditation, either formalized transcendental meditation or more informal forms of meditation, all have data that they improve sleep. So that mindfully living, choosing when you go to bed, being careful what substances you put into your body, all of these together will create a better condition for sleep.